Hello, my name is Fareen and welcome back to part 20 of ARN's ABA Parental Training series. In today's video, we will be exploring an assistive strategy that helps children with autism to display a particular skill or behavior: prompting. Prompting is the process of giving cues or hints before or during your child's action or response. There are a few different types of prompts used in ABA therapy. Verbal prompting. This is done through verbal instructions such as telling a child to say cookie when shown a picture of a cookie. Gestural prompting. This uses physical gestures such as pointing at certain items or pictures. Physical prompting. This involves taking the child's hand and making them point at the appropriate object or picture, or physically guiding the child to do the requested action. However, you should take note that physical prompting should be reduced over time, as when compared to verbal and gestural prompting, physical prompting can take longer time to fade out when teaching the child. While prompts can be useful to teach children with autism, the goal should be getting your child to respond independently without the use of prompts. To do so, take note of the following hierarchy that can help you decide on what kind of prompts to use depending on your child's response time or lack of response. We will go from the least intrusive to the most intrusive. Expectant pause. Give your child a look that indicates you are expecting a response from them. Indirect verbal. Give your child a direct hint that indicates to them that something is expected. For example, asking your child, "You want the car too?" and wait for the kid to answer. Partial verbal. This involves telling your child what needs to be done without telling or tapping the word that you want them to say. This works by telling your child, "Tap the icon for me to understand." Direct verbal. Give your child a verbal instruction that tells them exactly what to do. Gestural. As mentioned earlier, this involves physical gestures such as pointing, nodding, or looking at the icon or object. Modeling. Show your child what to do by demonstrating the action yourself. Partial physical guidance. This involves providing a gentle nudge at the elbow or shoulder to guide your child to complete the task. Full physical guidance. As previously stated, this involves taking your child's hand and gently guiding them to complete the entire step or activity. The idea is to start with the least intrusive prompt. If your child does not respond, move to the next level of prompting in the hierarchy and wait for a response. Make sure that you do not rush through prompts, as this will not give your child a chance to respond. It is important that your child does not become dependent on prompts in order to respond or complete a task. This is why prompt fading should be used after a certain period of time. As the name suggests, prompt fading is the gradual reduction of prompts down the hierarchy until your child is able to perform a task independently. Fade each prompt until your child performs independently without the need of said prompt. We hope you found this information to be beneficial. Prompting is a helpful stepping stone for your child to become more independent and make progress in their learning and development. If you have enquiries, feel free to contact us with the information shown on the screen. And if you happen to know of someone who may benefit from this video, do share it with them as well. Until next time, bye!